أعوذ بالله من الشيطان الرجيم بسم الله الرحمن الرحيم نحمده ونصلي على رسوله الكريم سبحان ربك رب العزة عما يصفون والسلام على المرسلين والحمد لله رب العالمين إن الله وملائكته يصلون على النبي يا أيها الذين آمنوا صلوا عليه وسلموا تسليما صدق الله العلي العظيم. Dear all, Assalamu alaikum. Hope all my students are in good shape. We come to this one isolated lecture of heavy metals. You might have gone through this toxicity and the antidote somewhere in your biochemistry. And not only here, this sort of intoxication or toxicology is also taught in your forensic medicine. They have a specific big portion of toxicology. So that knowledge will give you benefits not only here in our pharmacology but also in forensic medicine. So about the heavy metals, what we are going to cover over here. There are just a few heavy metals like the iron, mercury, arsenic, lead, and just few the chelating agents used to remove these toxic substances when they are in heavy concentration in the blood or body. So well-known drugs we will discuss over here. They are known as chelators. Well-known chelator, chela means claw, panja, claw, chelators. So what they do, chelators, they combine with the heavy metals, make a strong bond, and then these heavy metals, they are eliminated from the urine in general. So heavy metal poisoning, how it occurs, there are different ways. These metals, say the arsenic or this mercury or even gold, like that. So this people come across intoxication, say by the presence of lead or the arsenic in water, in the tap water, or arsenic may be there in the soil, or people working in industry, or where the paints are being formed and where the paints are being used, say in case of car painting, or in the houses and the paint, this lead is over there. So these metals, they're not only in the water or the soil, they are also present in the air. You might have heard about the lead-free petrol, also known as gasoline, lead-free. People working in mines, they are exposed to it. People where the effluents are thrown into sea and that seafood, the fish is used, and by eating that fish, and that may also intoxicate people. Well-known example is of one village of Japan, where this mercury that was ingested by the fish of that area and consumed by the people of that village, and that produced epidemic. So a number of ways are there. In case of say iron, if it is taken in heavy doses, say the syrup is taken or given by Hakims, they also give this iron, they also give this arsenic. So the toxic fat they bear, or even iron given for medical purpose and given in wrong dose. So big dose is given it is given intravenously or by injection, heavy dose is given. So there may be a hemocytosis or hemochromatosis like that. So all these different poisons, this mercury, or another one is the lead. You might have heard about the lead pipes to supply water. By that, lead intoxication may occur. And this lead also say used in the not only in the paints, also in the petrol. So it is work on these different situation to avoid it, and also a big use of say the mercury is in case of these batteries. Mercury, you might have heard about the mercury bulbs, mercury electrical bulbs. So there are industrial hazards. I have also come to know that certain foods like the chips, where they are stored or with them, where these foods, metals are ingested by the children. And you will go through different metals, their toxicity, and how to treat this heavy metal intoxication. Well, we come to the, just see please, and where I give certain points to note, have a notebook with you and kindly note them, maybe ask in your. So this heavy metal intoxication, ask your Viva, maybe in your MCQs is, so be careful. Come to the slideshow. What you are supposed to know about it. You should be able to recognize the the symptoms and signs of this heavy metal and how to deal with them. Is it, if it is acute toxicity or subacute or chronic toxicity, so how to deal with that. So, well, over the learning object, you see the enumerate. Just when we say enumerate, just you have to give the name, note down. This is no comment. The previous term describe, they are discouraged now, describe. So typical question just may ask the enumerate. Specific questions are being asked. To the point you have to write. Enumerate clinically useful criteria. You just have to give the names. Then the second one is write down their clinical indications. So where they are used. Maybe one chelator and used in say 2, 3 or 4 different metals to treat intoxication of different metals. Clinical indications and toxicity. Here then you should be able to deal with the iron poisoning, overdose is there, or syrup is given by some Hakim of iron poison. Then acute and chronic lead poisoning Then arsenic. Arsenic is also known as lucid. Note down, lucid. Lucid. Then mercury. Mercury. Next, here different these metals are given. Said the lead poisoning and to treat as iron, then mercury and arsenic. Just few. Other cadmium, there may be cadmium, there may be manganese poisoning, there may be copper. Yeah, you might have heard about other metals. That poisoning may also be there. Say the copper poisoning. You might have heard about the Wilson's disease, genetic disorder, where that copper deposits mainly in liver and damaging the liver. Next one, what is heavy metals? They are cation. Maybe in inorganic heavy metals in inorganic state or maybe even in organic state. So they interact with the sulfhydryl group. You know these are the essential groups of with the enzyme, sulfhydryl groups are enzyme. By this way they damage the body and they also interact with the regulatory proteins. These poisoning, the main effect of these heavy metals is on these. So these heavy metals they deposit in different parts of the body and damages almost all parts of it. Say they may damage one if ingested, they may damage GIT, then after GIT, the liver may be damaged. They may produce effect on the blood, toxic effect on, they may produce toxic effect on the kidneys, very important. Then also on the nerve. They may go into the CNS, so the toxic effects will appear over there. And another important one, they deposit in joints. The joints are damaged by these heavy metals. So be careful while prescribing these the medicines or to treat them. Even the drugs to treat this heavy metal poisoning, they have also their own demerits, side effects. First one given over here is lead, plum. You know a person dealing with a plumber, they are known as plumber. This is from PB, this is the abbreviation. Introduction with the lead. It is an environmental hazard present in air. You have been told, the lead poisoning, no lead-free petrol is said to be available. Lead is also used. So it is present in the air and also in the water throughout the world. There is no useful purpose of lead. May be ingested for suicidal purpose, maybe a homicidal purpose. So be careful while taking food and you have some adverse relation with any of your colleagues. It's no useful purpose in the body. Lead has got no useful purpose. But it is damaging. You see here the blood is being damaged with lead, liver is damaged, nervous system, kidneys, and yet not only this lead is damaging different parts of the body, but also even the other heavy metals they have got. If their blood level that goes high, and that will have damaging effect. So acute problem with the lead poisoning. Here you see the abdominal colic is there, and even there may be encephalopathy. So it's something emergency when it is acute encephalopathy. It must be treated at war footing. Well-known chronic toxicity is the wrist drop. Loss of appetite, weight loss, anemia. These are some common problems you may write anywhere with this sort of. Then and GIT disturbance with a chronic toxicity. Next drug, arsenic, is acute toxicity and be given. It is widely used, arsenic poisoning in industrial processes. It is present in certain arsenic level is also measured in this water, drinking water. Otherwise, this level is very much assessed even here in our country. Present in certain soils, so this level is measured. So whether the water is potable or not. It's also an environmental pollutant released during the burning of coal burning. It has also got arsenic has got carcinogenic effect. Arsenic poisoning, what would be the effect? Arsenic was used as a poison. Gas was arsen oxide. Gas was also used as poison in Second World War. And the Britishers, scientists of Oxford University, they prepared one medicine well known as dimercaprol. Note down, I'll teach you later on in this slide. Dimercaprol, di, 2, mercaprol. So, acute toxicity, when it was used as poison, this was vomiting, and special thing about arsenic poisoning, it is the rice water stool. Rice water stools. Rice, thin stools are there. And the smell of the stool and the breath is garlicky. Garlicky. Garlic, you know, it is thumum in our language. So when the watery stool be there, so dehydration and shock may be there, or arsenic. Then chronic toxicity, it affects skin is affected, color change, there is hair loss, maybe chronic toxicity, bone marrow depression, anemia, and GIT disturbances. Next one is about mercury. If you think about where mercury is used, you might have seen in the thermometers, mercury thermometers. This mercury is also in certain effluents, especially introduction. There are a number of mercury used in dental procedures. This for filling cavities, dental procedures. Also used in these batteries, also as preservative, also as insecticide, say the lice killer, jume marna, jume. You might have heard about the word jume. Yeah, and then even other insects also used in the batteries, manufacturing of battery electrodes. Mercury poisoning. So what happens? Mercury poisoning. If acute poisoning, chest pain is there, shortness of breath, GIT disturbance, mercury may have acute effect on the kidneys. Kidneys are damaged. Then CNS. Gastroenteritis may be hemorrhagic. Blood is over. There's blood loss. Again, it is given acute tubular necrosis, means kidney damage. Renal failure may be there. Chronic toxicity, the gums are affected, teeth are affected, GIT remains neurologic and behavioral changes, mercury toxicity. Then the iron toxicity, it may produce vomiting, GIT disturbance, lethargy, pneumonitis, jaundice. So it is effect. Jaundice means it is damaging liver. Even there may be seizures and there may be coma. Chronic, so it accumulates in different body organs. Hemochromatosis is the chronic intoxication problem. Then chelators. Chela, you have been told that it is jaw, so they they make a bond with the these substances, they make a bond with the metals, and then that is excreted. Organic compounds with two or more electronegative groups. What are chelators? These are organic compounds with two or more electronegative groups that form stable bonds with cationic metal atoms. With cationic, here you see electronegative, and they are forming bonds with cationic metal atom. These stable complexes are often excreted readily. They function as chelators, as chemical antagonists. Here you just note down antagonism and what are the different. One example of chemical antagonism over here. These substances, you also study these heavy metals, say in case of gastric antacids. Note down, gastric antacids, chemical and are used as antidotes in the treatment of heavy metal poisoning. Different chelators, well-known chelators. From right side, just take note on dimercaprol, dimercaprol, its oral form Succimer, and then one above is the penicillamine. Previously, penicillamine from penicillin, when the penicillin goes into urine, this penicillamine was discovered from urine penicillin. The main indication in the past of penicillamine was for copper poisoning, the Wilson disease. Anyhow, it's nephrotoxic. So, and the next substance given is unithiol, dimercaprol unithiol. Dimercaprol is given as injection, deep injection. It has very important toxicity. Then EDTA, ethylene dichloroestic tetraestic acid. EDTA. Deferoxamine. Here the word you see deferoxamine. Deferoxamine. From the word as you see, the ferroxamine is from iron. Ferroxamine, iron. For ferroxamine, iron. Here you see ferroxamine. Deferoxamine. Then let's go to the next slide. Bidentate. 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 Here you see double bond. Dimercaprol, Succimer, unithiol, penicillamine. Polydentate. EDTA, deferoxamine. These are polydentate. Tridentate, three bonds are being formed. Deferoxamine. Then these are the names. It is division according to the bond forming. Two bonds are there, three bonds are there, like that. Then the first of historic importance is the dimercaprol. You have been told that it was specially prepared to treat this arsenic, anti-leucite, British anti-leucite. So again, also known as ball, British anti-leucite is arsenic, note down. Given deep intramuscular because of its toxicity and its very painful. Clinical uses main the arsenic poisoning, then acute mercury poisoning, then here is Lead poisoning. Ethylene diamine tetraestic acid. Lead poisoning. Main is the EDT given over there. Toxicity of dimercaprol is sometimes it may be there in the exam. So it's a hypertension, tachycardia, headache. This dimercaprol, note down please. It is also histaminergic. Note down this word, histaminergic. So the related effects will appear over there. Histaminergic. Toxicity, paresthesia, fever, and then nausea and vomiting, pain and hematoma, thrombocytopenia, PT, prothrombin time, and that increases. Next, Succimer. Succimer, it is dimercaprol. You have to concentrate on that. It is water soluble and oral form of the dimercaprol for chronic Succimer. So you have to consider again. I say lead toxicity. The Succimer is given for lead toxicity, for arsenic poisoning, for mercury poisoning, toxicity. It may be toxic fats will be those of not only the dimercaprol. In addition to that, you may see in a skin rash, elevation of liver enzyme, elevation of liver enzyme, skin rash, elevation of liver enzymes. You know that liver is unithiol again are the water soluble derivative given earlier dimercaprol. You have to concentrate on dimercaprol. Then unithiol, about that indication like the dimercaprol, arsenic, mercury poisoning, and lead intoxication. Here you see three medicines, three heavy metal intoxication is affected. Dermatological reactions, toxic, unithiol, dermatological reactions, hypotension. Hypertension is also very important. There may be hypertension and hypotension, both may occur. Penicillamine, you have been told earlier, the older main indication was the copper poisoning, penicillamine, penicillin derivative. It is water soluble. So those were things not given in slide. Please also note down they are also important. The first time penicillin amine it was discovered from making penicillin. Here you see the various applications of penicillamine, main the copper poisoning, and the drug was known as coprimine. Then another one is the gold poisoning. Note down, gold poisoning. Gold, where is this gold given? Just please note down. Then arsenic poisoning, this penicillin, and then also lead toxicity. Also another very important use in addition to this, rheumatoid arthritis. Note down, rheumatoid arthritis. As the drug is nephrotoxic, kidney function is assessed. So the toxic effects will appear with pancytopenia, hemolytic anemia, nephrotoxicity with proteinuria, lupus erythematosus. Ethylene diamine EDTA, you might have studied earlier. Diamine tetraestic acid. Ethylene diamine tetraestic acid. This substance is highly polar, and as it chelates calcium, the calcium level that goes down, for that reason it is combined with calcium disodium salt, EDTA. Where EDTA is used for lead poisoning, for zinc poisoning, for manganese poisoning. Lead poisoning, zinc poisoning, It is also nephrotoxic, like penicillamine, like other drugs, nephrotoxic, renal tubular necrosis, and there may be ECG changes. Deferoxamine and deferoxamine. Here, as the name indicates, iron is to be removed from body. Deferoxamine, it has high and highly selective affinity for iron and much lower affinity for aluminum. It competes poorly for heme iron. Heme iron is not touched in hemoglobin and cytochromes. Iron in cytochrome and hemoglobin, that is not deferoxamine. Newer drug is your nuclear with selectively high affinity for iron. Deferoxamine clinical uses, the main use here you see it's for the iron one. Acute iron toxicity, iron overload if it is there, say by blood transfusion. If the hemochromatosis is there. Toxicity of this iron, you have been told that given by chemo. Joints are affected, kidney affected, skin reaction, blushing, erythema, urticaria, and another one is the histaminergic. Not only this is one is histaminergic, dimercaprol is histaminergic. Histamine release and hypotensive shock. Histamine release and hypotensive shock. It's the toxic phase, it's histaminergic. So the related effects will appear. Maybe neurotoxicity, retinal degeneration, hepatic and renal dysfunction, severe coagulopathies. Here you see a number of damaging effects are there. Eye is affected, nerves are affected, liver affected. So what is not affected, you have to remember. Then here is another, say, summary type. Lead poisoning. For acute lead poisoning, dimercaprol EDTA is given. For chronic Succimer and then EDTA. Then arsenic. For arsenic poisoning, beta-shantilucet is given. For chronic also beta-shantilucet is written. Mercury poisoning, Succimer is written over dimercaprol, Succimer or unithiol. These are two MCQs. As you know, these are very beautifully formed by your AP, Dr. Pracha. A small child is brought to a hospital emergency department suffering from severe GIT disturbance and colic is there. Colic, note down colic. If this patient has severe acute lead poisoning with signs and symptoms of encephalopathy, treatment should be instituted immediately with acetylcysteine, deferoxamine. So this here you see what you have to do. If this patient has fear, here it is the lead poisoning. So you have to write down which of the drug is more effective. More than one drug may be even effective, but here you have to trace that. The MCQ number 2 in the treatment acute inorganic arsenic poisoning. Maybe organic, maybe inorganic. The most likely drug to be used, you have to point out deferoxamine, dimercaprol, EDTA, penicillamine, Succimer. So just point out, thank you very much. I hope all of my students to work very hard during, and inshallah, like the previous class, you will give us 100% result. As you know, your senior class, all of them, they got promotion, although there were around 34 supplies previously. Best of luck, all my prayers are there, and also I expect my students to pray for your teachers and all the around for the college and for the whole Muslim Ummah. Thank you very much.